Hello everybody, welcome back to my channel. Today's video we are going to talk about must malnutritional universal screening tool. Malnutrition universal screening tool, it's usually called as must. It comes with the assessment station where you do obs of the patient, blood pressure, pulse, respiration, temperature, oxygen saturation, and all those things. And then you include must check the patient weight, height, and then it should be recorded. Weight and height should be on the form. We only do it for the diabetic patient for screening purposes only. What is their level of their weight loss or weight gain, or whatever the scenario may be. So let's start the video without any further delay. As you all know, we always follow the marking grid for the Osce exam. In the marking grid, the first station is to check if patient is safe. If the patient privacy is maintained, and then if you're standing at the right level, right space, I mean just to go very close to the patient right away. You are there to get a set of observations for the patient. Okay, so the first thing we need to do is check the scene safety. If the scene is safe, then you're gonna draw the curtains for the patient privacy. You're gonna wash your hands. If you have a sink close by, go wash your hands or use the alcohol hand gel. Maintain personal hygiene. And then when you do the hand hygiene, you need to state all the process involved. However, if the examiner or assessor says you don't need to do the pre-procedure, you don't need to do the introduction, just start with the actual procedure. Okay, so we have done the pre-procedure. The next thing for us is to do the patient ID check. And then what do you do in the patient ID check? You check the patient name, date of birth, hospital number, and the address. But if it's a community patient, you check the name, date of birth, and the address. In the hospital number, but if it's in the community, address of the patient. These are the three things only we need to remember. And you always check the patient name with the patient verbally, with the ID band, and with your notes. Three things. Just remember three things 3 times. Verbally from the patient, the ID of the patient, ID band of the patient, and then your notes. After that, you're going to ask the patient if they have any allergies and what is the reaction of that allergy. What kind of reaction do they get if they are saying that they are allergic to peanuts? What kind of reaction they get from it? Then you're going to ask the patient that what is the reason for their what is the reason of this admission. And then if they tell you that this, and then you need to tell also why you are there. Okay, just tell them, explain to them the reason of your encounter. All right, then before you start your things, you need to just keep in mind that you are a nurse. You need to see the surroundings of the patient. If there are any cigarettes, if there are any eyeglasses, or if there is if patient is nil by mouth going for a surgery in your scenario, if there is any water on the table. So just check for the surroundings. It's always according to your scenario what you're getting. So for this one, we are doing the diabetic patient. Just as an example, we're doing a diabetic patient. We are here for the observations and the screening tool, just to see where do they score on their must scoring system, and then how much support they need from dietitians or from the other team or the medical teams. Okay, so before we start our obs, we can ask the patient if they are in any kind of pain, or if they want you to do anything, if they need to use the toilet or anything like that, and then you start your procedure. So after the introduction, all these things you have asked them, you have checked the scene. If you have checked the surrounding of the patient, there are no cigarettes. But if you see cigarettes, what you gonna say? I can see you have a cigarettes on the table. Do you smoke? And they say, yeah, I do smoke. Okay, how many cigarettes a day? Have you ever thought about quitting? You can just give a general health education on that particular topic. And also, you're not going to leave the cigarettes on the table, because we have oxygen running around, right? We have oxygens in the rooms. So it gives us, it is a higher chance for the fire if we leave the cigarettes or the lighter or anything close to the oxygen cylinder. So keep in mind, we need to either lock it or give it to the patient relatives. Yeah, just tell the patient, I cannot leave it here, I lock it in the drawer, or I will give it to your relatives. Yeah, I cannot leave it on the table. If you see eyeglasses on the table, ask the patient, do you need your eyeglass? Do you use it for reading, or is your eyeglass only for the vision? Yeah, so if they need eyeglass to, if they need their eyeglass right now to see you, give them. Yeah, and also if your patient is going for a surgery and they have water on the table, ask them, have you had any water this morning or today or anytime? Have you had any drinks? Are you eating? Or just confirm with the patient if they're still nil by mouth. Okay, and these are the things you just need to be alert and conscious about, the things about your surrounding. Keep a distance from the patient when you're standing. You went there to do their obs. Yeah, ask their permission. I'm here to get a set of observations on you, if you don't mind. It will include your blood pressure, your oxygen saturation, your pulse, and your respiration and your temperature. Just get their permission, get the patient consent in each and everything you do. Yeah, patient consent, whether it's verbal only, it is very important in all the aspects of the nursing care that you provide. Just ask the patient, can I do it? Is this the right time for me to do the observations? Do you need a toilet? Do you need a drink or something? Yeah, just confirm with the patient before you start doing your observations. Yeah, so we have done the pre-procedure, we have done the introduction, now we are on the actual procedure. I would like to remind you here, if you haven't seen my previous videos, I have audio videos about the whole assessment station, including MUST, including PHQ-9, and about neurological observation also. All the videos I have in the audio mode as well. What is the benefit of watching that video? Because it will give you all the information how we do it in actual station, how we do it in actual exam. Yeah, just don't forget to watch that videos. If you're watching these face-to-face guidance videos, make sure you remember you watch those as well, because they are quite helpful. Those are the videos I recorded when I was still practicing for the Osce. Yeah, they are still very, they are up to date. There is no change as such, but you can go back and watch those videos to get full insight of the complete procedure. And then I usually do, I most of the time, it's always, I think, in the time, if assessment is for 12 minutes, I completed it in 11 minutes or 10 minutes. So it will give you exact guidelines how you do it according to the time, what is the process that you need to follow. And then if you're doing the observations, I have the video for the assessment station with the PHQ-9, with the GCS, with the Bmi Score, and with the neurological observation. Don't forget to watch those. Now we are starting with the actual procedure. What do we need to do with the actual procedure? First and foremost, you need to perform hand hygiene. Perform hand hygiene before touching the patient, before entering the room, after touching the patient. If you touch anything, any surroundings of the patient, if you have touched any body fluids or anything like that, wash your hands. So now we are going to touch the patient, right? To do their observation, wash your hands, or use alcohol hand gel. After that, you have the BP apparatus. As you know, I've made it clear in the previous video also. You have the BP apparatus. You need to check if it's clean and it's in working condition. And also you need to state when is the next test due date. Yeah, you can say that I've checked my BP apparatus, it's clean and tidy and it's in working order. The next test due date is this. Okay, and this BP cuff is of appropriate size of the patient. So usually if you're checking the blood pressure for a child, you use the small cuff, isn't it? If it's adult patient, you're using a big cuff. If it's a large patient, you're going to use a large BP cuff. So just check the BP cuff is of appropriate size. Now, so just tell the patient, I'm going to check your blood pressure. Which arm can I use? If they say you can use my right arm, so then you're gonna tell them, have you ever had any surgeries on that arm? Is there any fistula or cannula on that arm? Is it appropriate for me to do your blood pressure on that arm? If they have any fistula, if they have cannula, or if there is any skin problem, allergies or anything like that, you cannot do blood pressure on that arm. If they have any joint problem, you cannot do blood pressure on that arm. So just tell the patient, ask them that, is it okay if I do blood pressure on this arm? And the second thing you're gonna tell them is that when I put the BP cuff on, it will squeeze your arm for a few seconds and then it will be all right. Yeah, just keep in mind that it's gonna squeeze your arm for a few seconds and then it will give me the blood pressure reading. Then how you gonna put the BP cuff? The tubing, it always come on the antecubital fossa here, and it should be 2 centimeters above the antecubital fossa, from here 2 centimeters above, and then there should be a difference of 1 finger in between the cuff and your arm, in between the cuff and the arm. So don't make it too tight, and then just explain that I'll make sure that I put the BP cuff on 2 centimeters above the antecubital fossa, and then 1 centimeter difference in the cuff and the skin. And this is the only thing that you need to mention when you're checking the blood pressure. So this was the thing for the blood pressure. Now we're gonna check the patient pulse. For the pulse, the oxygen saturation probe that you're gonna put on the hand, you can tell the patient, I'm gonna check your oxygen saturation. Which finger can I use? Always ask the patient that if they want you to use the particular finger. And then before putting the oxygen probe, you need to check the capillary refill time. Just press it for 2 to 3 seconds. If the colors come back, it's for, just check their capillary refill. If it's getting red back in 2 to 3 seconds, it means your capillary refill time is good, 2 to 3 seconds. So yeah, and then just use that finger, put the oxygen probe on. You can check the oxygen level and the patient heart rate on the monitor also. But here you need to make sure you do it manually and you check it for 1 complete minute. You tell the patient, I'm gonna check your pulse and then I will count it for 1 complete minute. If you have a mannequin, you're not going to do the pulse, right? But you still need to state it that I'm gonna check your pulse for 1 complete minute, and I'm gonna also check your respiration. But don't tell them that I'm gonna do your respiration now, because it may alter the results. If you're telling them I'm counting your breathing rate, so it may alert the patient, and then it may give you incorrect results. So just tell the patient afterwards, while I was checking your pulse, I also checked your respiration rate, and it is within the normal limits if it is. Then after that, you need to check the patient temperature. Here when you check the patient temperature, what are the things you need to remember? Check if the ear is clean, if there is any discharge, if there is any blood or anything there, or if there is hearing aid, if the patient is using hearing aid. So if they have hearing aid, you need to remove the hearing aid, and then you need to keep the hearing aid off for 10 minutes. Then you can check the temperature. Why do we do that? Because there are batteries in the hearing aid, and then it will make the temperature high in the ear, because if anything electrical or anything with the batteries, it increase the temperature of that particular area. There are batteries in the hearing aid, so it will make our ear warm or hot. So you need to remove the hearing aid for 10 minutes, then you can do the temperature if they have the hearing aid. But if they don't have, just inspect visually. I can see there is no residual, there is no discharge, there is no bleeding. I'm happy to check your temperature on this side. Is it okay for you? They say yeah, it's fine. So you're gonna put a new probe on and then check the temperature. When you check the temperature, tell the patient before checking that you will hear a beep sound, because I'm checking it in the temperature. This is the thermoscan. We check it in the ear, and then it will give you a beep sound. Don't get alerted by that. Just explain it to the patient. Then it's all right, it's everything done. Then you're gonna record it on the, on the news chart. You're gonna record it on the news chart and then give the patient all the readings that your respiration was this, your SpO2 was this, and then this is your news score. I'm gonna come back on this particular interval. If your score is news 0 to 0, that means it's very good, that you don't need to come back every 4 to 6 hours. You can come back after 12 hours and then do the OBS again. If news score is 0, if news score is 3, but make sure that you know it's not 3 in one particular parameter. If it's giving you news score of 3 or 2, 3 in let's say SpO2 is 90 or 82, it's giving you a news score of 3, you're gonna do it every 1 hour. But if news score is 3 in different parameters, 1 in respiration, 1 is blood pressure, 1 in SpO2, then it's fine. Then you can do the OBS every 4 to 6 hours. But if it's 3 in one single parameter, you need to do it every hour. And then keep an eye on that patient. If it's giving you 3 in breathing rate or respiration rate or something like that, keep an eye and then escalate as appropriate. Okay, so this is news score is all done. We have done our OBS. We are going to explain to the patient that your results are this. We have explained it. Now is the must is the problem. I know it was so difficult for me when I was preparing for Osce also. I didn't like must and PHQ-9 because it gets complicated. Maybe because like you don't get enough information how to explain it to the patient, and but now I've understood how to do it and then how to do it within the time frame. You're done with your observation. Ask the patient if they have any questions, if they have understood all the things that I have done. If they want you to ask any questions, and then wash your hands, and then tell the patient I'm gonna do a must score. Is the malnutritional universal screening tool. If the patient has gained weight or if patient has lost some weight, you're gonna do the must screening tool. Just explain it to the patient. I'm gonna do a screening tool for you for your diet, and then I'm gonna refer you to the dietitian if needed. If is it okay for you if I do it now? And they say yes, you can do it. Then you start with your form you will get for must. Malnutrition universal screening tool. The first thing is name of the patient, date of birth, height and weight, and medical record number is also there. Then the first question you're gonna ask is about their BMI. What is the BMI score of the patient? For BMI score, how do we get the BMI? We need the height and weight of the patient, and it's there, so you don't need to worry. And this form is usually pre-filled in the exam. You don't need to do it. I mean, you need to calculate it. However, it will be pre-filled. It will be pre-filled here. It will be pre-filled here. You just need to calculate it to make a final, to make a total score. Okay, the first question, it says BMI score. So the first option is over 20 or over 30, means obese. Over 30 means obese. 18.5 to 20 is the second option. It's a kind of yellow, and then less than 18.5 is an orange. So it also gives a score, But we are going to do one option only. We don't need to go here. It's for the next time when they do it again, because here they have different dates also. You can write different dates also when you do it again. So this is the first thing we're gonna do it. So the first point is BMI score. BMI score they mentioned is 18.5 to 20. It's quite low, isn't it? The second step is weight loss score, unplanned weight loss in last 3 to 6 months. And then they said less than 5% is a 0 score. I didn't mention here. Over 20 or over 30 is a 0 score. We don't need to worry. 18.5 to 20 is a 1 score. We need to be a bit conscious about it. Less than 18.5 is a low score, and it's 2. It's orange. Then it says weight loss score, unplanned weight loss in last 3 to 6 months. Less than 5% is a 0 score, which means good. Between 5 to 10% is a 1 score. More than 10% weight loss is a 2 score, is a high score. Then calculate disease effect score. If the person is acutely ill and there has been likely to be no nutritional intake for more than 5 days, then you select here. It will be pre-filled if it is. Yeah, so now for our patient, it's 18.5 to 21 score, and then between 5 to 10% they lost weight, so 1 score for that. 1 and 1. Number 2, total must score is 2. We just need to write 2 here. Then we're gonna write the date, time, and signature. Now you can when you get this must score, you have done your OB, so you can tell the patient, I got your malnutritional universal screening tool, and then it tells me that your BMI score is 18.5 to 20, which means you have lost you are a bit underweight. Is that correct? And then you can also ask the patient that, have you lost any weight recently? So they can tell you, like, in 3 to 6 months I have lost loads, I've lost 10 stones, or I have lost 5 stones, whatever they say, because it's usually pre-filled, and then maybe it's confirmed from the patient as well. So whatever is written, you can just tell the patient that, I can see on the forms, on your forms, that you have lost 5 to 10% of your weight in last 3 to 6 months. Is that correct? And then they say, yeah, it's correct, because I've lost 10 kgs, I've lost 5 kgs. Okay, and then you total, and then tell them it gives you a total score of 2, and then I'm gonna explain it to you. What does that mean? What does that 2 means? So you will get this paper also. In the exam also you will get this paper. It gives you all the information. If the score is 0, what does that mean? If score is 1, the meaning of that, and then 2 and high. So it gives you all the information. You don't need to remember. Just for your basic practice, when you practice, just practice it, explaining it to the patient, and then prepare your mind how you're gonna explain it to the patient. Yeah, so it says here, if the patient is getting, so our patient got the total score of 2. Remember it, yeah? So it says here, management guidelines. This is the thing we need to explain it to the patient, that point. Whatever score, whatever they got the score, only that point you can explain. If your patient got 0 score, just explain the bit in the 0 score. If your patient got 2 score or high, just explain the bit here, 2 or more high risk treat. Yeah, so our patient got 2 score. We don't need to tell them about 0 score and 1 score. We are going directly on the 2 score, but I'll explain it to you. What it does it say? 0 score means low risk, and what we're gonna do is routine clinical care, repeat screening, if they are in the hospital, weekly. If they are in care homes, monthly. If they are in community, annually. For special age group, for example, more than 75 years. So that is the point for low risk patients. And if your patient is getting score 1, means medium risk, then you're gonna do, what you're gonna do is observe. You're gonna document dietary intake for 3 days. If adequate, little concern, and repeat screening. So if they say you need to document dietary intake for 3 days, if the dietary intake is adequate, you are a bit concerned but not too much, and repeat screening. If they're in the hospital, weekly screening. If they're in care home, at least monthly. Community, at least every 2 to 3 months. And if inadequate, if the dietary intake is not enough, then you're gonna do clinical concern. You will be concerned clinically. You are going to follow local policies, set goals, improve and increase overall nutritional intake, monitor and review care plan regularly. For number 2 or high, refer to the dietitian, nutritional support team, or implement local policy. Set goals, improve and increase overall nutritional intake, monitor and review care plan. If they are in the hospital, weekly. If they are in care home, monthly. Community, also monthly. So I have read it. I understood what does that mean. My patient is getting total Must score of 2, so I can tell the patient that, so your total score is 2, which means you are at high risk of malnutrition. We're gonna refer you to the dietitian. We will make some we'll provide you nutritional support, we'll set goals, and then we will try to increase your overall nutritional intake, of course with the dietitian support. And then we're gonna, since you are in the hospital, we are going to monitor you every week, and then and when we will go according to the plan from the dietitian. Is that all right for you? If patient says yes, that's good. So you can also explain it to the patient, for the time being you can have small frequent meals, try to eat as much as is possible, and then also tell the patient that what I was going to say, tell the patient that try to eat as much as you can, and try to eat the foods that you like, your favorite food, because if they have no appetite, if they don't feel like eating, if you give them the food they crave for, maybe they'll eat something. So just tell them eat small frequent meals and try to eat your favorite foods. So this is the must tool. We have done it, and then in the exam I'll put the example that I've done it, assessment with the must. You can listen to that audio. I will give you a more appropriate idea of how to do it. So we have done the observation, we have done the must score. Now you can also ask them, can you please tell me, with that weight loss, how does it affect your activities of daily living? Is there any particular thing you are worried about? Just ask for their concerns, and then perform hand hygiene, and then go home. Then you are done with your procedure. Make sure you remember that time is 12 minutes only for the assessment station. You're gonna fill up the news scores chart. You're gonna fill up the malnutritional chart, and then when you explain to the patient that must scoring, I can see you have lost weight, you have done this and that, and then you can also ask that how does it affect your activities of daily living, because if this is the point where you're gonna get the information, and then you're gonna plan it later on in your planning station, you're gonna write it in the evaluation station as well. So make sure you remember to ask this 2 or 3 things. If they say, yeah, it has affected me in different ways, I'm overweight now, I cannot walk much, or it's affecting my sleep, you can write about the mobility of the patient, you can write about the sleep pattern of the patient, and then give guidance, health education. If you're having trouble sleeping, avoid caffeinated beverages at night. If you cannot walk much, try with the small steps, walk at least 15 minutes a day, or then increase it accordingly if you can bear it to do that. Okay, that's it guys. I hope you like this video, and then if you like it, please give it a big thumbs up, share it with your friends, and subscribe to my channel. It means a lot to me. I'll see you soon in the next video. Take care. Bye bye.